Inappropriate sexual behavior in adolescents with autism spectrum disorder. Adolescents with ASD have sexual needs, but may not understand their physical and emotional development, resulting in inappropriate sexual behavior. The aim of this review is to describe the type of inappropriate behavior that presents in these adolescents, explains why such behaviors occur. Sexual behaviors that occur in these adolescents with ASD include inappropriate romantic gestures, inappropriate arousal and exhibitionism. Such behaviors are thought to be caused via a lack of understanding of normal puberty, the absence of appropriate sex education, the severity of their ASD and other associated problems, inappropriate sexual behavior, and the child with an autism spectrum condition. Sometimes the adult will allow a younger child with ASD to do something of sexual nature because it may seem funny or cute, or they do not mean anything by it, or because the adults feel uncomfortable addressing the issue. A child will be much more vulnerable to abuse if allowed to think that stroking an adult's breast, cuddling someone they don't know, kissing someone on the lips, talking in public about sexual matters, or masturbating in the presence of others is acceptable behavior. A child with ASD, even more than other children, may need to be taught that there are certain rules about how we behave which can help keep them and others safe, such as with whom sexual concerns can be discussed. It might be easier for some to write their sexual relationship concerns down in a specified book and have an appropriate adult write the answer in the same book. This may work if the child does not want to voice their query. Children with AS will also need to be taught that there are some times when others may want to hug them if they do something really well, like passing a school test, or if they have done something very kind for someone. All sexual touch and action should be cited firmly within the context of a relationship of whatever type to aid understanding. It is important to realize that people with ASD can have difficulty understanding others' body language, facial expressions, and tone of voice. In addition, they may not be aware that their own behavior is inappropriate and that it can be distressing for others. Watching TV and films, children often witness scenes of a sexual nature. A child with ASD may easily misinterpret these and develop an unrealistic notion of how relationships develop. Explaining sexual issues to children can be a daunting task, but it is crucial that children with ASD are taught this clearly and calmly and in a way that they understand. Children with ASD may need to be taught what to do in certain situations, as they may not learn these things intuitively like other children. It's very important to begin the teaching process as soon as possible.